Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Hello and welcome tonight to the Heart of Health Live. Dr. Marcum, our wonderful host, is enjoying some special time with his family. I have had the privilege of co-hosting with Dr. Marcum. I am Michelle Chin. I am a nurse practitioner working in the healthcare setting, and I have a wonderful guest with me tonight. Her name is Glenda Parks. She is a master's prepared registered nurse who specializes in lactation consultation. A simple way to say that is that she is a breastfeeding expert. And we have the privilege of having her here with us tonight. We would like to take your questions. You can call us by dialing 855-644-3278, or we also have the ability for you to send in text messages. That phone number for you is 423-834-7307. We would love to hear from you. We would love to hear about your personal experiences when it comes to breastfeeding, any topics that are surrounding that. Our guest speaker tonight has worked with mother and child for about 27 years, the last 21 years as a breastfeeding lactation expert. So we are just more than happy to have your questions for us tonight. We recognize that may be a little bit of a sensitive topic for some people, so just a little forewarning if you have little ones. It might be a good educational time for them, but just to let you know that is the topic that we're going to be talking about. It is Breastfeeding Month nationally, and we are very happy to have her with us tonight. And again, those phone numbers for you to call in, 855-644-3278, and text messages 423-834-7307. You're going to want to stay tuned with us. We have a special guest in Heidi who's bringing little Owen for us too. Stay tuned.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Would you like to experience better physical and mental health? Then consider volunteering in your community. Studies have shown that youth who give of their time to help others perform better in school, have greater self-confidence, and are more likely to become leaders in society than those who do not. And amongst adults, those who volunteer experience better physical and mental health, lower rates of disability while maintaining their autonomy as they age. And amazingly, these benefits persisted even after taking into account baseline limitations, socioeconomic status, health status, employment, exercise, smoking, and marital status. When we volunteer to help others, we activate the brain's love circuits, which calm the brain's fear circuits, reducing inflammation, thereby reducing physical and mental illness. To be smart requires a healthy brain, so be smart, live to give.
To learn more about mental health, visit comeandreason.com. Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Could it be this simple? Changed my life. What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking.
This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A Biblical Model for Healing the Mind at Amazon.com or wherever books are sold.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'd like to welcome you back to our show. This is National Breastfeeding Month, and we have with us a special guest, Glenda Parks, who is an expert at lactation. She's an official lactation consultant. We'd like to encourage you to call in with your questions. Even if you're a grandmother, I know I'm a grandmother, and oftentimes it's the younger people looking to the grandmothers and the older generation to answer the questions that they may not know about. And so we encourage you, even if you're a grandmother or an aunt, feel free to call us. That number again, just quickly, 855-644-3278. And if you'd like to text us, 423-834-7307. Welcome.
Hello.
Welcome, welcome. It's nice to have you here.
Thank you.
One of the things I just wanted to ask you, how did you get started in breastfeeding? I mean, it's not something people usually say, I want to grow up and I want to teach people how to nurse.
Well, the first thing is, even though I nursed my three boys, when I started working with mothers and babies in a newborn nursery in 1986, I was trying to help these mothers, and sometimes they had questions or concerns or things that I really didn't know as a nurse that I wasn't exposed to in nursing school or through my own experience on how to help them. So I strove to get more education and be certified as an international lactation consultant so that I could then provide them more accurate, not just, well, this was my experience or this is what, you know. I wanted to be able to give them the facts and the support that they really needed starting out.
You know, you use the word international there. Is it different? You know, if we get people viewing us from all over the world, does it make a difference where they live geographically? Is there cultural differences?
Oh, there's lots of different cultural differences.
What are some of those differences?
Well, in the United States, one of the things that mothers we hear a lot is, I don't have enough milk. In the Pacific Rim cultures, they have too much milk.
Wow.
We have a lot of Hispanics here in the Chattanooga area, and quite often they will say no leche, no leche. They have no milk, and they want to do formula and breast too, but mostly formula because they have no milk. Not understanding, even though that we tell them body works on supply and demand, the more the baby goes to the breast, the more milk you'll produce. I have no milk, no leche, no leche. So they want to do the formula. Oriental cultures sometimes feel like, certain ones, that the colostrum, that first milk that we consider so important as liquid gold, is poisonous, that they don't want to feed their babies at the breast until their more mature milk comes in.
So there's a lot of education
so
there.
it depends on what culture. I had one Hispanic mother one time told me that her friends told her when she came home from work that her milk would be too hot for her baby, that she would have to give the baby formula when she came home from work. And I said, why was that? And said, well, she couldn't understand why. I said, your milk is only going to be the temperature of what your body temperature is. So if your body temperature is not too hot, your milk's not going to be too hot for the baby. You know,
yeah.
So
let's go back to one of those. I know that is a common question among new moms. How can I make more milk? Is there a way to make more milk? You know, you're saying they say I have no milk. How does that work?
Well, one of the best things to do is as soon as the baby is born, have the baby place skin to skin with you so that oxytocin, that hormone that helps eject milk, is starting to be released. And that baby next to you then instinctively quite often will start to root and search for the breast. If they're swaddled up, passed around, they don't even know mama's in the same room. So getting that baby skin to skin, putting him to the breast in that first hour or 2 hours after birth, that helps that mother start initiating that production of milk instead of delaying the production.
Now, I know that you take care of moms and babies before they're even born, and you do education right when they're born in that first hour, and also people that may have problems later on. So how would you say to a mom who may have problems later on and feel as though her milk came in the hospital, but now she doesn't know if she has enough milk to be able to feed the baby going forward? What would be your answer to her?
Well, first of all, I usually will ask some nosy questions. I'm going to ask, do you hear swallowing when the baby's at the breast? What are they doing beforehand? Are they licking and looking for something when they get done? Are they limp like a rag and got their jaw locked down? That tells you baby got full, doesn't want any more. We also watch what's coming out the back end. If they don't have enough wet and poopy diapers, then no, there's not enough going in. But if they have enough coming out the back end, baby's not going to make it. Comes out of mama, goes in them, comes out the other. So we ask all those kind of things. But quite often when babies go through growth spurts, mothers think they don't have enough milk because they're wanting to eat all the time.
Right.
Well, during those growth spurts, they need more calories to fuel all that growth that's going on there. And they need that energy. And so usually for 3 to 5 days, they'll feed a whole bunch till they get out of that growth spurt, and then they'll settle back down to a more normal pattern. But quite often mothers will equate what their formula-fed mother friends are doing to what their breastfed baby is doing.
That's true.
So they think, well, my friend only feeds her baby every 3 to 5 hours, and I'm having to feed this baby every hour and a half, 2 hours, and so it's not right. Instead of seeing breastfeeding as normal and that those bottle-fed babies are not normal, they want to kind of make them
try and make it the same,
and it's not.
What would you say to a mom who said, you know, I feel like I need to make more milk? Are there ways, are there fluids they can drink? Are there any particular fluids they can drink? How do you encourage a mom to increase her breast milk, or at least to be able to meet the needs of the child?
Well, one of the things that they can do is to do as much skin to skin, get the baby to nurse as much as they can, and after that, if baby won't take any more because they're full, gone to sleep, then manual express or pump a little bit extra afterwards so that you'll have very empty breasts. Very empty breasts signal the brain, we didn't make enough milk this time, we make more next time. That's why
it's training your body as part of this.
As part of that. And then you don't want to cut your calories under 1,500 calories a day, because long term your body thinks it's in starvation mode, and so some of those mothers that are on low calorie find that their milk production may drop. You don't have to drink enough to float the battleship, you drink to thirst. And there are some women that certain foods can increase milk production. There are all kinds of recipes out there for lactation cookies and that kind of stuff. My daughter-in-law swears every time she eats my oatmeal butterscotch bars, she always makes lots of milk afterwards.
There you go. It's a good reason.
So, you know, but whole grains, things like that, that are going to help nourish the mother, but it's not any special foods per se, but it's what works for that mother.
You know, you had mentioned they're not to have their calories too low. While they're breastfeeding, you see different guidelines. Do they need to eat more calories than if they were not breastfeeding?
Well, most women will burn about 200 to 500 calories a day making the milk. Usually 100 to 150 of those calories are what they put on their body while they're pregnant, and the rest comes from their diet. So I tell mothers, if you eat an extra sandwich and a couple of pieces of fruit, that's usually going to get that extra in there. You don't have to, you know, or eat a peanut butter and jelly sandwich, you know, eat bagel with cream cheese, cheese and crackers, you know, whatever's handy.
And would that increase their weight, or?
It doesn't usually increase mother's weight, but it's going to help her feel satisfied and have the energy to take care of this baby.
Well, those are good words of wisdom, because those are questions we get quite a bit. We're going to pause here for a break. I would like to encourage you, please call in with your questions. Our phone number is 855-644-3278. If you'd like to text us, 423-834-7307, and we'll be right back.
Heart of Health Live will return in just a moment.
Heartwise Ministries, and these adorable sheep. Want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, everyone. I'm here with my special guest, Glenda Parks, who is a lactation expert, and we're taking your calls on any questions you might have on breastfeeding. We have a caller, Lou. You had a question about breastfeeding. You're on the line now with Glenda. What's your question for us?
Hi. Actually, I am wondering if breastfeeding an adopted baby is a feasible thing to do.
Yes, it is. The longer you know beforehand that you're going to have this child coming in, the better your success. But there is a website that's called Ask Lenore that's on the internet that she has protocol that's been established with her and a physician for induced lactation. And if you don't have enough time, there are things called supplemental nursing systems that you can put either donor milk or formula in a container that hooks around your neck. There's a tube that goes by the nipple, and as baby sucks, they will stimulate your breast, which will help produce milk, but they'll also get food at the same time. So
right. Yeah, I've looked into it quite extensively, and our little one, we're adopting through foster care.
Yes.
She's 8 months old right now, and by the time I'm able to actually attempt anything, she'll be close to a year. So I purchased a pump. I haven't been brave enough to try it yet.
Okay.
And I'm 44, so I'm wondering if relactating. I haven't lactated for 24 years now.
Hey, it's easier for somebody to relactate than somebody that's never been pregnant, okay? But I was kind of in the same situation. I had a child that we adopted, that we took in at 10 months as a foster child, and I had to make that decision. Was I going to try to induce lactation or not? Because we didn't know if it was going to be temporary, and we ended up adopting her when she was in kindergarten. But at that time, we didn't know how long we were going to have Lisa. So I didn't go ahead and strive to do that. But I encourage mothers, whether you have foster children or whether you're adopting a child, do as much cuddle time with them, skin to skin, loving them. If they seek the breast, fine. If they don't, that's okay. You know, but there are ways that you can nurture and nourish this child emotionally and physically. If you produce some milk, that would be fine. If you don't, that's fine too.
Right. Yeah, I guess I was kind of hung up on the hormone issue. You know, because I'm perimenopausal.
Yeah.
And I don't even know if there is such a thing as actually attempting to relactate when your hormones are so out of whack.
I'll tell you, we had a 47-year-old mother one time that had in vitro with triplets. So if a 47-year-old mother can have in vitro with triplets, you might be able to produce some milk if you desire to choose to do that.
Okay. Well, that's very helpful. I appreciate it.
Okay.
Thank you, Lou. Appreciate your call. That's an interesting topic, not something you hear about very often, and it's interesting that they can go ahead and do that, because that is quite the bonding experience.
Yeah. They don't have to, you want it to be a pleasant experience. You don't want to have to force it. You know, this child is 8 months old. He's probably had bottles all this time, maybe never even had the experience of the breast. But just having the child, skin to skin, if they seek the breast, fine. If they don't, that's fine too. You've still had that closeness.
Yeah, that's very, very important. When we're talking about breastfeeding, oftentimes you get the question, what medicines can I take? Can I be on birth control? Can I take over the counter? Can I take something for a cold? How's a mom supposed to know what she can or can't take so that when she's having that experience, she's not doing anything detrimental to the child?
Well, and she also doesn't want to do anything that's detrimental to her milk production either, because there are
that's a good point.
Because there are some things that can decrease mother's milk production. But there is a free app, if you have a smartphone, from the National Institute of Health called LactMed, L-A-C-T-M-E-D, and it has all of the current information with effects on lactation, effects on mother, effects on baby. You can read the whole reference. But it's a free app from the National Institute of Health. If you don't have a smartphone, you can just type in LactMed, L-A-C-T-M-E-D, on your search engine on your computer, and you can go right to that website, and you can look up anything that you want. But if you put it on your phone when you're going to the drugstore and you're looking at cold medicines, you can put in the individual medications that are in there and see if there's any detrimental effects on the baby or your milk production.
So it would also, you were saying about milk production, it would also say on that website, this may be safe for baby, but it may decrease your milk production.
Yes, it will have both of those things on there.
That's good. That's very good. Very
because there
helpful.
are some antihistamines that can, and some women can decrease milk production. You ask about birth control. We encourage mothers first to use a barrier, would be first. Next would be a mini pill with progestin only. That way, if they have a drop in milk production, they can always quit taking it. If they get a shot of birth control or get an IUD put in, if they have a drop in milk production, you can't take those away.
Right,
okay?
right.
And once mother after 6 months starts introducing complementary foods, then they can usually take a combination pill and not have too much drop in their milk production, because by then milk production is well established. It's not as detrimental as starting it at 6 weeks.
Right. You know, you talk about an app that you can download. It seems like just from even having an app that it's becoming more acceptable, more encouraged. Are you finding through the years of doing this for so long that do we have a swing towards more breastfeeding, or do we seem to have a swing towards less breastfeeding? Where would you say that is?
Actually, we're swinging more toward breastfeeding, because at this time it is really being promoted not only from the nurses and from the websites and that kind of stuff, but also American College of Obstetrics and Gynecology are supporting breastfeeding. The American Academy of Pediatrics have got, they're recommending that all their residents go through as they're in their training, a special program for helping them learn how to help with breastfeeding. Also, the CDC which is the Center for Disease Control for those that don't live in the United States, are doing big pushes for promoting breastfeeding, because that's one of the preventive things that we can do early on to help with health throughout the whole life.
How does it do that? Well,
there's certain things that are in breast milk that help protect the baby, okay? There are certain essential amino acids that help with brain and eye development. There are antibodies that are in mother's milk that coats the gut, keeps germs out. There's also things that, there's cholesterol in breast milk, but babies learn how to handle cholesterol, and they find that later in life, the people that were breastfed, their cholesterol levels tend to be lower. You have a lower cholesterol level, it's going to decrease your risk of coronary artery disease, stroke, those kind of things. They've also found that there's certain childhood leukemias that's decreased in people that were breastfed.
You know, we're going to be taking a break here, but one of the questions I would have when you're coming back is, you know, we talk about the benefits to the child and all of these things. How does that translate into later life, as you were describing? And how publicly aware are we doing in those programs? So it's just some important things that we need to know. Would like to encourage you to call in with your questions, no matter what they are. Our call-in number is 855-644-3278, or you can text us at 423-834-7307. We would love to hear from you.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, Speaker, Director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
It is good to have you back. I am Michelle Chin, sitting in for Dr. Marcum, who is enjoying some very special time with his family tonight. It's a pleasure to be with you here. I have as a guest speaker Glenda Parks, who is a lactation expert. She's been sharing with us some of her insights on breastfeeding, the arts of breastfeeding. And stay tuned with us, because coming up in our next segment, we're also going to have little baby Owen and Heidi, and she's just going to be sharing some of her experiences and talking to Glenda about what she's been through. Prior to this break, I was talking to Glenda about, why are we seeing such an increase in breastfeeding, an increase in awareness? We talk about the benefits. It's good for the child. I mean, why is it now it's so much more accepted? Now you can go into Target, or some of these, you can go to the aquarium here in Tennessee. They actually have breastfeeding rooms for mothers with small children. Is that because of the benefits? What would you attribute that to?
Well, part of it is that back my mother's generation, we swung away from breastfeeding, and the scientific thing to do was to provide your child formula. But I tell people, I remember my mother mixing up formula for my brothers that included carnation evaporated milk, Karo syrup, vitamin drops, and water. How was that better than mother's milk? Okay, when I had my children in the late 70s, early 80s, it was seen more as a lifestyle. And then they started looking at a lot of these common diseases, obesity, childhood leukemias, GI problems, all of these things, and they started looking at taking histories and looking at the risk factors and what were some of them, why were some people getting them and some weren't. And one of the things that kept popping up was breastfed individuals didn't have some of these problems that some of them that were formula fed. One of the big pushes that we do at the hospital, whether they're breastfeeding or formula feeding, is to teach feeding cues, because quite often new parents, the first time, every time a baby cries, it has to be because they're hungry.
Absolutely.
And so they're thinking CDC and American Academy of Pediatrics is putting big push out there for teaching feeding cues rather than feeding on schedules, because so many of these parents think that the baby needs to eat so much every so often, and maybe the baby's not hungry. And we're teaching them to overeat and be stuffed, not being satisfied, and so they're thinking that's part of our childhood and adulthood obesity. It's because we have taught from a very young age to overeat. And so they've looked at things and started looking, and the CDC is really putting a push out there. Even the Surgeon General of the United States is pushing, breastfeeding. The Affordable Health Care Act, there are provisions in there for paying for lactation services and breast pumps and those kind of things. And so they're realizing.
Sounds like there's a combination of a lot of reasons. Now, when we talk about the benefits to a child for breastfeeding and the long-term benefits, just as you spoke about, that studies are coming out saying that truly this is more beneficial for this person. What about if you're a smoker? What if you're a smoker? Can you still breastfeed? Is your child still going to get the benefits of being breastfed, or will they not?
Well, as far as the American Academy of Pediatrics, as of 2001, took smoking off of their counterindication list. So they say that they would rather a smoker breastfeed than not breastfeed, because in smoking households there's increased SIDS, there's increased respiratory infections, asthma, those kind of things, and all of those, breastfeeding helps diminish those. So they're hoping that it'll be more of a balancing act. And what we tell our smoking mothers is best would be to wait an hour to an hour and a half from the time you smoke to the time you nurse the baby, not to smoke around the baby, of course. And in the newborn period, because their feedings are so irregular, at least 20 to 30 minutes, because in that first 20 to 30 minutes, that's when the chemical levels are going to be the highest. That's when there's going to be decreased blood flow to the breast, decreased blood flow to the brain, and so they're not going to let down as much milk as they would later. But we would rather a smoker breastfeed than not breastfeed.
So it sounds like the benefits outweigh the risk, is what I'm hearing you say. Yeah, that's a very good thing. What are some of the more common questions that you get from your patients when you're working with them when it comes to breastfeeding?
Well, one that I hear quite a lot is, my baby favors one breast over the other. And that is very common. We're not sure, is mother more comfortable, baby more comfortable? Does the nipple fit in the baby's mouth better? Is it that they possibly had at delivery, they have a torsion where their neck muscles are tight, so it's hard for them to position a certain way. You know, we're not sure what it is, but the majority of my mothers will tell me that babies have a favorite breast, and that's okay. And what I just tell those mothers, if the baby's frantic, start them on their favorite side, give them 3 to 5 minutes on their favorite side, like us getting an appetizer before the meal, remove them, move them over to the second side. But we don't time how long a baby's on a breast because you're feeding a baby, not a clock.
Sure.
Some babies will suck almost continuously and will empty a breast quickly. Others suck and rest, it takes them longer to get done. Or those babies that are sucking, resting, coming off, and you haven't put it back on again, they're going to take longer to get done. So why should we say in being 10 minutes, 15 minutes, 20 minutes, whatever it is, that we move a baby to the second breast? Because we all eat at different paces. Newborns do. I do. You know, my husband and I can sit down together and I'm talking and eating and it takes me longer to get done than him. You know, if I have a big family gathering, we're all eating at different paces. So we can't say that everybody's going to eat the same amount the same way.
So there's really no set time?
No.
So we don't have to say 5 minutes here, 10 minutes there. So if they do have a favorite breast, basically what you're saying is take the curb off of that hunger appetite, switch to the other side.
And then they can always finish up on their favorite side.
Very good, very good. What are some other questions that you hear more commonly?
Well, can they breathe? Because everybody worries that they need to pull the breast out of the baby's nose. And I just tell those mothers, just bring the hips in, tuck them in, their chin will come in and the nose will naturally fall back. They don't have to worry about holding the breast out of their nose. Even a mother that's very large-breasted. You know,
so positioning is what you're saying.
Yeah, and mothers need to be comfortable and baby does too. And it is, you know, the natural, but everybody has to learn. Yeah. We didn't learn how to walk the first time. The child walks across the floor. If they took off and walked starting out, we would just all fall over on the floor. They stand up, we applaud them, they fall back down, they take a few steps, a few days later we applaud them and then they start going. So everybody starts at a different pace, and so we can't say everybody's going to take off on that run because that's not reality.
Very different, very different. Another question for you before we go to break and before we bring Heidi and baby Owen out for you all, and that is it, because we're going to be talking about what is it when the transition, when mom leaves home and goes back to work, and we'll be talking about that in our next segment. But the question that I have for you is, what about combining breast milk with formula? You may not have enough milk, or maybe you're going to the store, you haven't prepared some. Is it bad for the baby to combine the two?
Well, breast is always best, okay? But there are some situations that sometimes mothers don't have adequate milk production, but depending on which author you read, it's usually anywhere between 1% and 5% of women that either don't have enough hormonal or glandular set up to make adequate milk production. We tell those mothers, if they're going to do a combo, to always breastfeed and give the breast milk first and only use formula if they don't have enough. Because again, in the newborn period especially, if mother feels like they don't have enough milk, they're given more formula, baby goes less to the breast, they make less milk. So it's a self-fulfilling prophecy.
Oh, I see, I see. So, but it's not going to hurt the child.
No.
If you have to mix them, great. Stay tuned with us. Please call in with your questions. Our number is 855-644-3278. You can text us at 423-834-7307, and we will be back with baby Owen.
The Heart of Health Live will return in just a moment.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Heartwise Ministries and these adorable sheep. Want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Consultant actually, and there was some initial latch problems as expected, I guess. But after that, he did pretty well. He took to it right away, and I guess the biggest thing I worried about in the beginning was supply and do I have enough? And
so how'd you answer that question? Grandma Glenda is just itching to get this child, and I have to admit, he's across the table, and I'm ready to go get him myself. Right. Adorable.
All right, you asked
so
the question.
how did you know that? How did you know whether you did or didn't have enough?
I actually went to some friends and posted a question on the Facebook to get a lot of responses, and discovered that it's very normal at 6 weeks to go through a growth spurt, and that baby wants to nurse all day, and it was out of the ordinary for him. Mm-hmm. So I thought that I was drying up, and turns out it was very normal. And I took a lot of the suggestions that people had, just drinking plenty of water, relaxing, don't stress about it.
So now, was this a breastfeeding site on Facebook, or was just, hey, all my friends that are my age?
Yeah, I think
how
I
did you take care
addressed
of this?
all the moms,
all the new mommies.
Yeah,
there you go.
That's what I did. So then after that, it was very clear that I was making enough for him, and it went fine after that.
So just from their reassurance, and then also I guess he would have been seen by his physician fairly recent.
He was in the 95th percentile for height and weight at his 1 month visit.
There you go.
I was pretty certain he was doing well.
He was doing well with that.
Yeah.
I know that that's a question we had talked about earlier. Other than he has what if he continues? She's saying that it changed for him. What if you have a child that they were eating with this pattern, and then it's like a growth spurt pattern, but it never backs off again?
Then we encourage those mothers to call us and talk to us, because we're going to ask some nosy questions. First, did they ever have any breast surgeries? Are they taking any new medications? Or are they on hormones, or did they have infertility issues? Did they have all kinds of different, insulin-dependent diabetic. We're going to ask some nosy questions, thyroid medicines, those kind of things, to see if there might be a medical reason why they're having a lower milk production. Or is it that I pumped and I only got 2 ounces, and I know that's not enough for my child, but pumping isn't the same as a baby. Baby gets a lot more milk than the pump does. I tell mothers all the time, there's no warm fuzzy feelings toward a pump. Just something to trick your body to release the milk.
Yes, yes.
So.
And he's obviously looks very, very strong, Heidi. Proud Mommy smiling at him. But Proud Mommy did have to go to work. Heidi is a nurse practitioner and is working. So how was that transition? How did the breastfeeding go for you during that transition time?
I actually want to say it was pretty easy. I planned ahead of time to kind of, I had to start pumping a few weeks before I went back to work to have a little bit of a stash, but actually I haven't needed. I've actually contributed to it as I've gone. Basically, I pump what he needs at work for the next day. Every time he would be eating at home is when I'm needing to do a pump. So.
And how easy was it for you where you work? I mean, we have talked about how it's becoming much more acceptable. How did your peers accept, okay, I'm going to go take a break, okay, I'm going to go take a break again? How did that go?
Again, I think I prepared for it ahead of time and let them know even before I went on maternity leave that I need a break here and I need a break here because this is when I'm going to be pumping, and made sure that they knew that was going to be happening for a long period of time. And definitely helps to work with supportive people and to make sure you have a room to go and the time. I think it's...
Glenda, do you have anything that you may tell people, new moms? What if they're not in a nice situation that Heidi was in where it's quite so supportive and they're going back to work? How do you encourage moms to continue breastfeeding, and how can they talk to their bosses and the people that they work for to just express to them how important that is to them?
Okay. First of all, back to that Affordable Health Care Act, if you work in an employee, for an employer that has more than 50 employees, they have to provide a private place for you to pump that's not a bathroom or a storeroom, and time to pump. It doesn't have to be paid. It can be unpaid, but that is covered in the Affordable Health Care Act, and it took into effect in July of 2010. So that's always the backup, but I always also tell mothers all the time that, you know, pump before the day starts. You know, if you don't have a long break in the middle of the day, you know, in the morning, then do a short pumping in the morning, a longer pumping at lunchtime, and a short pumping in the afternoon. But you can work it around that. We have some of the nurses that work on the floors that will take the computer on wheels into a empty patient room and will pump and chart at the same time.
There you go.
And so there's ways to work around this. And if you tell the employer that you're less likely to miss days with a sick child, that your work's not backing up, or they don't have to pay somebody to cover for you while you're out with a sick child, that's going to help the work environment. And I tell mothers all the time, they're going to spend less time pumping than a smoker's going to spend outside smoking.
Very true. Heidi, how did little Owen take to your absence and taking to a bottle? Was there a training that needed to go in for that? And then was it hard for him once you came back and wanted to nurse between deciding bottle breast? How did that go?
Sadly, no, he did fine.
He didn't miss you as much as you wanted, huh?
I think the first day he did, he wanted to nurse extra long that evening when I came home, but he had no trouble going back and forth. Because I think we started around week 3, just kind of getting used to it.
That's usually what we tell mothers is around 3 to 4 weeks. You want to introduce a bottle once a day or once every other day. Yeah. Sometimes if you wait until after 8 to 10 weeks, they're like, no, Mom. I'm not, you know.
Yeah.
So that's the best time to try to do it.
So there's actually a training period. If you know that you're going to be going back to work, then you would recommend just a little bit of a training period for the child.
Yeah, and I tell people they don't have to drink 2 ounces or 4 ounces at a bottle those first few times. Just put a small amount in the bottle, just have baby accept it, learn what to do with it, and then you can always top them off if you're at home. But if you put 4 ounces in there and baby only drinks 1.5 ounces or 2 ounces, that's 2 ounces of your time that just went down the drain. So let's not waste your time. You've got a new baby, you need your time.
And we have a new adorable little guy here. Yes, we do. He's growing very well. What is the recommendation? I mean, Heidi's just starting. Owen's only, 11 weeks old right now. What's the recommended time that you should, what's the minimum time that would be recommended to get some of the benefits that we've discussed? And what is there a good time to wean a child once you're breastfeeding?
Well, as far as the recommendations are that exclusively breastfeeding for the first 6 months, that's American Academy of Pediatrics, CDC, World Health Organization's recommendation, and American Academy of Pediatrics says breastfeeding up into the 2nd year of life. They don't say is that 1 year and 1 day, or is that 1 year and 360 days, whatever. But quite often, around 1.5, 2, they start a natural weaning process as they're busy and do other things, and they realize with a sip cup or bottle they can move around, and with mama they've got to sit still. But worldwide weaning age is between 2.5 and 4. It's just in the United States.
So there's quite a big window there.
Yeah. Just in the United States, quite often people think that something's wrong if you're still giving the baby the breast.
We're going to be right back in just a few minutes. Again, if you'd like to call in, 855-644-3278. You can text us at 423-834-7307. We'll be right back with little baby Owen.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We have the privilege of having Glenda Parks with us, a lactation expert, which means that she is a breastfeeding expert. And we have Heidi, a new mom who is breastfeeding the wonderful and gorgeous little Owen. Heidi, any words of wisdom for any moms out there just like you, new little guy heading back to work? What do you think?
Well, I think there is definitely some effort that takes place, but I think it's worth it and definitely possible for the working mom. So
good, and it sounds like it's been working for you at work, so that's encouraging as well. And he is absolutely precious and definitely looks like he's staying nice and healthy. Glenda, any thoughts on your part? What would be your leaving remarks, your closing remarks for our audience tonight?
Well, we encourage mothers to go to prenatal breastfeeding classes. Learn as much as you can. Talk to other mothers about their good experiences. Know that there are going to be some bad experiences that you're going to hear about, but there's bad experiences with people learning how to dance or doing anything, you know. So it's going to be your experience, and ask for help. Once you go home from the hospital, they can always call, email,
Facebook their friends.
Yes. And there are mother chat rooms that quite often they will connect with each other even during their pregnancy. I don't know if you did that or not, the prenatal, that there are some on. And so those kind of relationships, and know, is it accurate information, whether you're receiving it from a friend, a physician, a nurse, a lactation consultant. And I tell mothers all the time, what's right in your gut is what's right for you and your child. And I want breastfeeding to be part of your life, not to feel like it's overtaking your life.
Good advice, very good advice. If they have questions after this show, is there a way that they can contact you and your expertise?
Well, I work for Erlanger Health Systems here in Chattanooga, Tennessee, and you can go, just my email address at work is glenda.parks@erlanger.org. And you can email me some questions if you have it. I have a folder that I keep all my mother emails in and my replies, so that if somebody emails me again, I can always refer back to what we talked about before. Just helps me keep my life in line.
And it sounds like it keeps you on your toes too, because I'm sure that the caller that we had tonight that's adopting a child, it has not been that long out there that a woman in her 40s can adopt a child and yet even consider that she might be able to breastfeed that child.
Yes.
So times are changing. Yes. And we would definitely like to thank you for being on, and thank you, Heidi, for bringing little Owen, the little star of our show, with us. Again, if you have any calls or if you have any questions, you can email Glenda at the email address she just described to you. We'll have that up on the screen for you. And we will also have any questions that you might like to have for us. We'd like to thank little Owen for showing up and his bright little blue eyes. We'd also like to invite you to stay tuned for our credits tonight, where we have a special treat for you. A little Owen, who has been our star thus far, has a little surprise for you that he would like to share with you about how he came into the world. So stay tuned for a very special treat. And it's been a pleasure being with you here tonight.